In this episode of CARPe Diem.
Changes that happen with age increase a person's risk of heart disease. However, there are things we can do to delay, lower, or reverse our risk. 80 to 90% of cardiovascular disease is preventable.
CARPe Diem, seizing the day for Canadians as we age.
Welcome. On today's show, we're going to discuss our heart health. What causes a heart attack? Can we prevent one? We'll ask our expert panel. First, let's meet this week's Zippy Zoomer. Leah Bolton, take it away.
We are back with our Zippy Zoomer. Her name is Lynn. She's 72 years old, and whoa, watch out.
Good job. 2 more. Got that one?
It's a good workout.
It's a good workout.
And then I do lots on my own as well as my designated hours. So.
Like what kind of stuff did you do there today?
I did an hour training with Kamal.
Okay.
And then I did another hour of like Pilates and stretching and just things that are good for me.
Making sure your lower back maintains its contact.
One time we'll do upper body, the next time he'll have me doing all sorts of squats and things. Another time we'll do a lot of lifting.
Let's do a plank.
He just changes it around. Yeah, every time is kind of different.
Abs contracted. Okay, what you're gonna do is lift one arm up in the air and the opposite leg up.
I have a little bit of a shoulder thing going on right now, so I did some special shoulder exercises. And that's usually about 2.5 hours altogether.
Knees bent a little bit more.
You sort of sometimes think that you hear the number and then you're like, well, I don't know what you're capable of, but then you just see what sort of comes out, like the ferocity. Like I said, she's super dedicated and she's willing to do anything, so I love it. She's just super like, sure, I'll try it.
How did those abs feel?
Just fine.
Yeah, strong, be strong.
In a busy day, we did some workouts, and now you're doing the walking thing again.
That's right.
Even in those shoes, holy.
I brought some extra flats for later.
And now we're heading
To my sister's closet.
Okay,
Yeah.
so this is where you volunteer.
That's right, yeah, every Wednesday afternoon. And all the money that's made at the store is given directly to Battered Women's Services Society.
Wow, amazing.
So,
and I hear you have some fashion sense.
I think I do, yeah. I think I'll start with the windows.
Okay,
Have a
sounds
look
great.
around.
Sold, I'm getting this outfit. Now I have to take it off.
Lynn, you're killing it. Love it.
We're gonna keep going here. In the meantime, we're gonna head back to the studio with Carmen. If you have a Zoomer to nominate, well, don't forget to nominate them at zippyzoomer@carpe.ca. Forget it, I quit.
She's on the right track. Let's get right to our topic today, heart health. Dr. Chakrabarti, what is heart disease?
So when you're talking about heart health, we're talking about cardiovascular health. Talking about the heart, it can be related to the heart muscle or the heart arteries or the electrical system of the heart. And conditions which can adversely affect the outcome of our patients. Those are things we talk about heart disease. But there's a spectrum between continuation of health and disease. So we'll talk about it later.
Carmen, a buddy of mine used to say that the best thing that you can have is a non-fatal heart attack. And when you talk about 80 to 90% of heart disease being preventable, I think that's very true. So I'm excited to share today with our viewers the things they can do to, short of a non-fatal heart attack, help themselves live better and longer.
And I really want to learn about what you have in your hands.
Yes.
Yeah, we're going to learn about that. When we return, we're going to talk about what happens to our heart as we age.
Still ahead on CARPe Diem.
Other than cholesterol testing, how do we know what shape our cardiovascular, our arterial system is in? Because you can have healthy cholesterol, but if you have narrowing in your veins that is congenital, it doesn't matter.
CARPE Diem. Seizing the day for Canadians as we age.
Welcome back. In this segment, we're talking about how age affects our heart. Let's watch this.
A healthy heart, as seen here, beats approximately 60 to 100 times a minute, providing oxygen-rich blood to the rest of the body. The lower left chamber of the heart, called the left ventricle, is the main pumping chamber. There are many different conditions that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease. Any of these can prevent the heart from efficiently pumping blood to the rest of the body. As a result, the heart may beat faster and the ventricle may increase in size, becoming an even less effective pump. When the kidneys sense the reduced blood flow, they attempt to compensate by retaining more water and salt. This excess fluid retention often causes congestion in the tissues and results in swelling and an increased strain on an already weak heart. The progressive effect of the heart failing to properly circulate blood and congestion due to fluid retention is known as congestive heart failure.
Shanta, congestive heart failure. What else happens to an aging heart?
By the age of 30 to 35, the heart starts losing muscle. So every decade from the age of, say, 35, the heart will lose 3 to 5% of its muscle. Yeah, and
so young, I had no idea.
Yeah, absolutely, it's fascinating. So as a part of normal aging process. But once the person reaches around 70 to 75, that loss starts getting even more accelerated. Say, for example, our skin. It's, you will see the skin starts thinning as with age. Our hairs start thinning with age. Similarly, something with the heart muscle.
What are some of the reasons why we're so susceptible to heart disease?
We inherit genes from our parents. There are lots of good genes, a lot of bad genes. So it's the dynamic interplay of your good genes and bad genes which will result in what your outcome is.
Now, we hear often about the sort of classic signs of heart attacks being, pain radiating down the arms, but I understand it's different for women than for men?
Yes, yes. Heart attack is when there is a blockage in the artery. So it's not only the symptoms, the very pathophysiology of heart disease is different in women than in men. And as a result, unfortunately, women get treatment later. Sometimes they are not even diagnosed. And sometimes they have different symptoms. I've seen several patients who have just minimal shortness of breath, but they're actually having a heart attack.
Well, you know what? We're going to interrupt our panel discussion and go to you. And because we asked you, did you have any questions for our cardiologist?
I had heart valve surgery when I was 70 with a tissue valve. Well, my question is, because it's a tissue valve, how long is it expected to last?
My father, due to having high cholesterol, this resulted in multiple bypass surgeries. For myself, I do control my cholesterol using Lipitor, but of course I always have that worry. What more should I be doing to ensure that I don't suffer some of the damage that he has?
Other than cholesterol testing, how do we know what shape our cardiovascular, our arterial system is in? Because you can have healthy cholesterol, but if you have narrowing in your veins that is congenital, it doesn't matter. How do you know? Can you feel it?
Shanta, would you like to address that?
Yeah, these are fascinating questions, and I'll use the heart model for this. So I'll open this up, and as you can see, these structures called the valves, which are in the heart. So the heart is a dumb piece of muscle. It just squeezes, but the blood needs to move in one direction. The valves help us to do that. Now, what the gentleman was talking about was having a valve replacement. And in the past, we used to use mechanical valves. And that would mean that the person would need to be on blood thinners for the rest of their lives. Can have clots, can stroke, and things like that. Nowadays, we use tissue valves, and most of them are from animal tissue, like pig valves or cow valves. But the problem is, because it's an artificial or something foreign to the body starts producing calcium and other immune thing against it. The valves may become thicker. Usually, we say these valves may last for 10 to 12 years, but it's also important to take care of them, because if these valves are subjected to infection or high blood pressure or something, they may degenerate and become stiff much earlier. There's new valve technology now. There are several valves we can do by putting the valves right from the leg, so there's no need for open heart surgery. So it's very important to have regular follow-ups, to have an exercise test or echocardiogram to look into the valves every year, every couple of years. And if there's new symptoms, to have these re-evaluated very quickly.
Is there any test I can take that will tell me if I'm at risk of having a heart attack?
Yes. There are two types of tests. One is if you're having symptoms. For example, person A is having chest pain on exercise. Then we will say, okay, have an exercise test done, and we do the ECGs at the time. If that is positive, or if we are suspicious, we can send you for an angiogram, which is looking into the heart arteries through putting a little bit of dye from the leg or from the hand.
Oh. We're going to take a short break, but before that, we kept talking to you about heart health.
Still ahead on CARPe Diem.
I never had an issue with cholesterol at all until menopause.
CARPe Diem. Seizing the day for Canadians as we age.
Welcome back. Now we're discussing what we can do for maximum heart health. We asked you, what are you doing to prevent or reverse heart disease?
I never had an issue with cholesterol at all until menopause, and that's when it kicked in. And I was shocked by it because it spiked really, really high, and couldn't even deal with it with diet. I actually ended up requiring the Lipitor to manage.
Well, actually, I recently started on a new activity mission back in March, sort of following the CARPe Stand Up Straight program. And I got back to doing a little bit of swimming and walking and cycling, and I'm enjoying much more time outside now, and really happy that I got back on track with my fitness.
I do crafts, so I sit at a table, but I purposely have everything in other parts of my house, so I have to keep getting up and down. So I get up and down instead of sitting there doing everything.
So studies say that 8 in 10 heart disease cases are preventable. What are your best tips?
You know, we talk about heart health, but it's entire body. And the heart and lungs and the brain and every system is related. Be active, healthy diet, moderation, discipline.
So when you talk about healthy diet, I'm interested in that because I hear different things. I mean, I remember at one time I was told to be on the DASH diet and that it was really important to control salt, but now I hear that that's not the case, and salt isn't really the big killer, and other things are more important.
Yes, you're right. You know, salt can adversely affect, but not all. Not all of us are salt sensitive. Only a minority of us are salt sensitive, and but having said that, having too much salt does retain water in the system, especially people who have got heart failure. In them it is important, but people otherwise who don't have heart failure and are not sodium sensitive, restricting salt too much probably will not add too much compared to doing other things. A big key player which is coming up is sugar. Canadians have far higher sugar intake than what is recommended in the form of free sugar or bound sugar, and that's resulting in significant problems in the form of insulin resistance, adding to heart disease, hypertension or high blood pressure, stroke. So that is something we need to be really very aware and advocate and work on it, not only for our seniors but even for kids.
And I think exercise is absolutely critical as well.
It surely, surely is. We keep hearing exercise plays a large role in our overall health. Let's hit the gym.
Who's winning?
I am.
Let's see those feet moving, right?
They move
I can, man. They're old.
In the last 6 years, Live Well Exercise Clinic has helped over 4,000 people transform their lives. Yeah.
I started Live Well Exercise Clinic simply because of my experience working in our local health authorities and really seeing the benefit that people had from participating in our traditional cardiac rehab programs.
Legs over, we're going to keep up nice and tall.
So I knew that there was a greater population out there who were not our typical gym goers and in fact were intimidated and overwhelmed by the concept of exercise and of healthy living.
I was doing less than half the speed I'm doing now. I jogged today for the first time for 3 minutes for the first time in like forever.
I think that's the way that medicine should be going, is using our allied health professionals, all coming together so that you can actually see the results. Even if they've never exercised and now they're into their 60s, 70s, 80s, it's still a really important thing to start.
Keep going. I'm Leah Bolton with Joy TV News.
I have two questions. One, I want to ask you, why do we not do what's good for us? But first, I want to talk to CARPe about Stand Up Straight campaign because you've embraced this 100%.
Sure, Carmen, and as you know, CARPe is an advocacy organization for seniors, and we're always asking for things that we need the government to do for our members. And I think that's completely valid. But we've also said, you know what, I think it's fair to ask our members to do something for themselves. And what more important thing could they do for themselves than exercise? So last year we kicked off our Stand Up Straight campaign to get people out in walking groups, being active and moving.
We talk about exercise, but I think the focus should be to be active. Exercise doesn't mean you have to hit the gym. I know many people do, and that's fun. But having said that, say when people have a heart attack and we say you need to go to a rehab, cardiac rehab, and we put them on exercise on the treadmill, unless the exercise itself becomes enjoyable, no one's going to continue doing that. On the other hand, many of our seniors have got other things going on. You may have a bad back. You may have had a knee surgery, or you may have something else. You may feel dizzy with the medicines that you are on. So therefore, being active, even getting up from your chair, is much more better than not doing anything.
Like the lady said in the interviews that she had crafting stations all over her house just to force herself to get up a little bit and just do simple things.
Absolutely. I'll give you an example. Suppose a person is 160 pounds. And if I tell that person, you know what, you have to move 160 pounds of boxes, it'll be perceived as hard work. But if you're moving yourself, you are doing that amount of work. Little things. Suppose you park your car a little bit away when you go to the superstore. Park your car at as far as you can, then walk it. Suppose you're going to just climb one flight of stairs and do the rest with elevators. Just adding on that 10 to 15% of what you would do more than what you would do adds substantial benefits.
I have yet to talk to a doctor that doesn't prescribe exercise as medicine, and I'm so very proud of CARPe for embracing this as a campaign, because I think we can all do something small, even just to go for a walk. We're going to take a short break, but first, let's hear what you do for optimum heart health.
More vegetables, less sweets. I still have a bit of a sweet tooth, but I try to avoid, whatever I can in terms of extra sweets.
We're a whole, and it is like the mental, the spiritual, the physical side, and with the physical part is we are what we eat too. And I drink lots of water. Sometimes I forget.
CARPe Diem. Seizing the day for Canadians as we age.
It's now time to go around the table for our panel's final thoughts on heart health.
Yeah, so my message is this. Look at this. This is your heart. You just got one of it, right? You got 2 eyes, 2 ears, 2 legs, 2 arms, but this is vital. It's pretty much like you've got a car, this is your car's engine. You have to look, everyone looks after their car, everyone does oil changes, everyone looks after them, so you have to look after your heart because very, very, very important. The other thing that I want to say is we talk about heart health, but it's just a part of overall health. Our emotional health, spiritual health, mental health, everything works together. You can't have a very good heart health with a not very good emotional health because all the systems are linked to each other. So it's a matter of prioritizing ourselves, investing 5% of your time every day in doing things that would help you in the long run. If you do it, then you can motivate others around you to do it, and it becomes a community movement.
First of all, boot camps are great if you're in the Marines, not so much if you're 65. So by all means, start an exercise program, but be gradual. Work at a level that you can sustain. And secondly, recognize that there are no magic fixes. I know sometimes on television, we hear people, even people that look like they have credentials, shilling for a particular product or a miracle pill. That should be a real red flag. There are no instant solutions. What there are some great trusted resources. So I really recommend that everyone who wants health information goes to two places. One is the work of the Cochrane collaboration, very clear research information. The other one is the McMaster Optimal Aging Portal. Those are two places for trustworthy information about heart health and every other aspect of aging, and I encourage our viewers to go there.
Well, I'm going to follow your advice, and Dr. Chakrabarti, thank you so much for being with us. And Wanda, always a pleasure to have you on the panel. And that's the show. Remember, as our CARPe president, Moses Neimer, always says, the best way to keep going is to keep going. So stay zippy, and CARPE Diem. Seize your day.